Have you ever considered how amazing your body is, especially when you are asleep? While you are dreaming, your brain is still meticulously managing every beat of your heart and every breath you take. But what happens if, just for a moment, your brain forgets this crucial task of breathing? This brings us to a fascinating and important question. Central sleep apnea primarily affects individuals with underlying medical conditions, often impacting the brain's control over breathing. Unlike obstructive sleep apnea, where there is a physical blockage in the airway, central sleep apnea occurs because the brain temporarily stops sending signals to the muscles that control breathing. The core reason some individuals are at a higher risk for central sleep apnea lies in specific health issues that disrupt the brain's respiratory control center. One of the most significant risk factors is congestive heart failure. When your heart struggles to pump blood effectively, it can lead to fluid buildup and irregular breathing patterns, which in turn can confuse the brain's signals. Additionally, kidney failure can also elevate your risk. Impaired kidney function can lead to imbalances in the body's chemistry that interfere with normal breathing regulation. Certain neurological conditions such as a stroke, Parkinson's disease, or brainstem lesions can directly damage the areas of the brain responsible for breathing, making central sleep apnea a more likely occurrence. Another major contributing factor is the use of opioid medications. Opioids, whether prescribed for pain management or used recreationally, can suppress the brain's respiratory drive. This means they can make your brain less sensitive to the carbon dioxide levels in your blood, leading to longer pauses in breathing during sleep. High-altitude living can also be a temporary risk factor, as the lower oxygen levels can trigger an unstable breathing pattern that resembles central sleep apnea. For instance, people visiting altitudes above 1,000 feet might experience temporary central sleep apnea symptoms. However, these usually resolve upon returning to lower elevations. If you suspect you might be at risk, the first step is always to have an open conversation with your healthcare provider. They can review your medical history, current medications, and any symptoms you are experiencing. Keeping a simple sleep diary, noting when you wake up feeling breathless or if your partner observes pauses in your breathing, can provide valuable information. Understanding the specific role of your brainstem and how its chemoreceptors respond to carbon dioxide levels in your blood is key. These tiny sensors tell your brain when to breathe. In central sleep apnea, this intricate system is temporarily out of sync. It is a nuanced condition that underscores the incredible complexity of our body's autonomous functions. By recognizing these critical risk factors, and understanding how underlying conditions can impact your brain's breathing control, you are better equipped to seek appropriate medical guidance. Managing conditions like heart failure or kidney disease effectively can often alleviate central sleep apnea symptoms. Consulting with a sleep specialist ensures a precise diagnosis and helps you explore tailored solutions, ultimately leading to improved sleep quality and a healthier, more rested you.